You're watching ABC4 News.
And welcome back. This month is National Heart Awareness Month, and doctors at Intermountain Healthcare say it's also a great time to assess your heart health, a very timely time. Joining us today is Dr. Viet Le to talk to us about heart disease specifically and how to help you stay as healthy as possible. Good afternoon to you, doctor.
Yeah, hi.
Thank you for joining us. Can you just first off, what is heart disease?
Oh my goodness, heart disease covers a lot of different things in the heart. So, you have plumbing, you have coronary arteries, and then, you have the rhythm of the heart. So that's that lub-dub that we think about often. And there are structures within the heart that are, you have chambers and then you have valves that open and close. So there's a lot of things that can go wrong, but a lot of things that go right.
Right. It's miraculous, right? How many things go right, but when they go wrong, it's very serious.
Absolutely.
Tomorrow is Wear Red Day, February 5th. Why is this such an important day and something to be aware of?
So Wear Red Day, in particular, we like to focus on women. So, greater than 50% or about 50% of the population are women. And I think people forget that women have heart disease. 1 in 3 women will have some type of heart disease in their life. And so we want to focus on Wear Red to remind us that, 50% of the population, women, will have heart disease.
Wow, that is a crazy statistic. So tell us, too, the various types of heart disease, because there's not just one problem, right?
Yeah, so as I spoke at the beginning, coronary disease, I think of those as the fuel injectors of the heart. If they plug up, well, the engine doesn't run very well. Timing, that rhythm, if signal lights are not timed correctly, well, cars will crash, right? So same thing can happen in the heart with rhythm. Those structures that I talked about in terms of the chambers of the heart, well, if they get floppy and big, we have something called heart failure, where blood doesn't pump very well forward, and it congests into the lungs, into the body, etc. Same thing if it's stiff. Structurally, you have these valves, and if they stick where they're not opening very well, then it's what we call stenosis, and very little blood will push through, or it regurgitates backwards.
So tell us, I want to go back to that statistics for just a moment. Why is it that women have such an issue with heart disease? Can you explain that in a short little bit?
Well, we're not that different, men and women.
Right.
We have this heart, and so the same kind of diet, the same kind of lifestyle issues affect both men and women. And I think that it's not that women don't have heart disease, it's that they have it just as often and as much as men do. So I think the problem has been that we haven't been good at messaging and letting women know that this is a big deal. It's a big part.
That it affects us too.
Yeah, exactly.
Okay, before we go, this is the last question, but I feel like it's so important. How can your lifestyle changes really help create a healthier heart?
Well, I'll tell you that it doesn't make us immune to heart disease, but what it does do is make us feel better. And so lifestyle changes such as looking at, increasing your grains, vegetables, avoiding sugars, etc., and exercising more. Get out and become physical. That engine wants to be revved, so rev that engine.
There you go. Thank you so much for your time today, doctor. There is so much we could touch on today. Sorry that time cuts us off, but we do want to let people know, for more information, you can head to intermountainhealthcare.org. A lot of information there for you. We'll also have all of this and the interview posted on our website, abc4.com. Again, thank you for your time today.
Thank you.